So, sorry, 3, 2, 1, we will live now. Over to you.
Good morning, all, and welcome to Life Pharma Coalition, a global knowledge and networking platform for pharma professionals. As you know, first Sunday of every month, we go live on Facebook and YouTube, and we invite industry experts to share about current challenges and best practices across pharmaceutical industry. And today's episode, LPC 205, is going to focus on one of the very important aspects of all the pharmaceutical marketing professionals, and that is 6 basic steps in pharma brand planning. And to share the content on that, we have one of the core LPC team member and mentor for this session, Mr. Anil Fernandez, sir. All of you are well aware about Anil Fernandez, sir. He have been associated with LPC for a long time as a mentor, as a guide, as a speaker. And sir is having more than 2 decades of experience in pharmaceutical industry. And currently, sir is a founder director of Slim Solutions, which talks about strategy, leadership, innovation, and marketing. Apart from working as a consultant to pharmaceutical industry, sir is a visiting faculty in SIS College, where he runs a program called Marketing Excellence Program for brand managers, group brand managers. And so far the experience is concerned, sir has worked as a CBO in Integris and also works as division head in Abbott Healthcare, Sanofi, India. So thank you very much, sir, for joining us today. And with me, I have my co-moderator, Dr. ICS Verma, sir. Thank you very much, ICS Verma, sir, for making it a time to contribute to LPC Life Pharma Coalition. Sir is currently founder director of New Direction Consulting and also co-founder of Expert on Board, a new initiative. So over to ICS Verma, sir.
Thank you, Ashwant, and once again, welcome to all the LPC lovers. First of all, a very happy birthday to you.
Thank you, sir. Thank you very much.
Wishing you all the best on behalf of Life Pharma Coalition.
Thank you. Thank you.
Okay. As you know, we are once again privileged to have Anil sir on the board today to be speaking on brand, because he is the one who is considered as a brand ambassador for any kind of pharma branding or pharma brand plan, whether you call it as a brand building. So because he has been working with many organizations in a position of leadership and into marketing, so definitely he will add a lot of value to this session. As we all know that brands are something like their identities. There are brands like we all see that like Foraguard. There are brands which behave like companies. If you are building them like a great brand, so definitely that is going to be one of the topic today, and we'll have a great learning in this session. Looking forward for this insight from Anil sir.
Thank you very much, sir. Thank you very much for your insights. And now we request Anil sir to start the presentation, take the session. And I request all the participants who have joined live on Facebook, YouTube, and even Zoom meeting to keep on sharing their learning in chat box. And also at the end of the session, we will have a quick recap. And also we will take opinion and feedbacks and questions from the participants. So over to you. And once again, thank you very much for Imagica Health, Yogita and team for their continuous support for live streaming. With that, we hand over to Anil Fernandez, sir. Sir, welcome.
Yeah, thank you very much, Yashwant sir and ICS sir. Happy birthday once again, Yashwant
Thank you,
sir.
sir. Thank you very much. Thank you.
And really welcome all the viewers on board for this session. Well, I think this is the time post the festivities where pharma gets into an overdrive of working on brand plans. So when Yashwantji and ICS sir were asking me to do something for marketing excellence on this program, I thought, why not talk about the critical imperatives for a winning brand plan? So that's how I thought of this particular session, and I'm sure it will come in very handy for the teams post the festivities as they get into the grind of working on their brand plans. So remember one thing, the marketing plan actually is the foundation that builds the very currency for your brands. Today, what I will be doing is I will be not so much focusing on what are the things that get into a brand plan, but rather we will confine this 30 minutes of discussions into what are the critical differentiators that make a brand plan succeed. So we will look 6 critical differentiators in order to really add depth and value to your brand plans. And that is where, the brand plan works as a critical currency for your brands. So can we get on to the slides, please?
Yeah. I'll start sharing the slides. Is my slide visible?
Yeah. Yeah, so that is going to be the subject of discussion today. And as Yashwantji said, I represent Slim Solutions. Pleasure to be once again back with LPC. Next. So remember, the first thing which is very, very critical for any brand is to set an objective. Take our own personal lives. You set an ambition for yourself, which represents a very goal as to what do you aspire to do in life. And brands are no different. So with a brand, you really need to have a winning aspiration as the starting point of building your brand plans. So remember one thing, the starting point of any strategy is your winning aspiration, moving from point A to point B. What do I mean by that? Take, for example, your brand may be in the top 15. So you will set a winning aspiration in the next 2 years. I want to move from top 15 to top 10. So one has to set smart objectives, or rather it has to be a BHAG. What is a BHAG? BHAG stands for big, hairy, audacious goal. You've got to take a tough winning aspiration if you want to build big brands. That's the very starting point. Let's move on to the next slide. So let us get into what defines a smart objective. So S is for specific. As I said, if you're in the top 15, you would like to move in the top 10. If I have a market share of say 25%, in next 2 years, I want to take it to 30%. So these are very, very specific goals that you set for yourself. Your goals can be long-term, intermediate term, and short-term. So long-term is in the next 2 years or next 3 years, I want to be in the top 10. That's clearly a long-term goal. Intermediate term is when you break it down into a 1-year goal. So in order to be in the top 10 in the next 2 years, at least by the end of next year, I have to move from where I am today to a certain point. So that becomes my intermediate goal. And then when I break it down into quarterly milestones or monthly milestones, it becomes my short-term goal. M is measurable. So it needs to have certain KPIs on basis of which you can measure how effective is your strategy and whether your strategy is yielding results or not. So you set measurable objectives. At the end of each defined period, each month you review that at the end of so-and-so month, this was my objective where I am today. Is there a gap? If there's a gap, what is the reason for this gap and how do I course correct? So to that extent, your objective has got to be measurable. It must be achievable. So achievable does not mean something that is within the grasp. So this is a wrong notion that people have about achievable. Achievable can be something which is an aspiration, a real winning aspiration, provided you have a proper roadmap, you have done a thorough analysis of the market to see where the opportunities are, you know where the threats are, what your weaknesses are, you take steps to mitigate them, you adequately allocate resources in order to make your plan operational, and you have a step-by-step approach to achieve that winning aspiration. So when you do all this, you are working towards making your plan achievable. So achievable doesn't mean taking something that is easily within my grasp, but achievable is putting all the plans in place to achieve your winning aspiration. Your goal has got to be relevant to the market in which you operate and to the industry in which you operate, and it has got to be time bound. So time bound, as I mentioned, it's clearly a long-term plan, 2 years, 3 years. It's an intermediate term plan in 1 year, where do you want to be? And in every month or every quarter, how do you break those plans? So the starting point is setting your SMART goals or your BHAG. Next, please. So this is how the objective flows through in a typical organization. So, you know, the corporate think tank, they will set a winning aspiration for their corporate that today I am ranked in the top 20, maybe through acquisitions and through organic growth. In the next 3 years, I want to move from 20th rank to 15th rank. I want to enter these therapeutic areas where currently I'm not present in. So these are the objectives at the corporate level. And at the corporate level, they really decide which are the markets I need to enter, which are the markets I need to consolidate, what decisions do I make in terms of acquisition and mergers in order to achieve my winning aspiration. So if I take a certain objective at the corporate level, ultimately the corporate breaks that down into the different businesses or the different BUs. And the BU head then breaks that down with the help of the marketing head to certain brand objectives. And then your brand communication objectives translates your brand objectives in motion in order to achieve the growth for the brand. And when the brand achieves its growth and its objectives, it helps in the BUs achieving their growth and in their objectives. And when the BUs achieve their growth and their objectives, the corporate in turn achieves their growth and objectives. So please understand this fundamental of the flow of hierarchy of how the brand objective actually gets derived from the business objective, which gets derived in turn from the corporate objective. Next, please. Yeah, next. So that is the first must-have, your winning aspiration and SMART goals, number 1. Second is you must know your category in which you operate. Like, you know, in the cricketing field, the captain sets the field, correct? The boundaries are very clearly defined. The object here is for the bowler to exploit the weakness of the batsman and to dismiss the batsman. And the fielders try to cover the ground so that if they anticipate a catch, the fielder is in place to take that particular catch, or the fielder is in a very strategic position in order to ensure that the competitor does not score enough of runs. So you check the flow of runs or try to get the wickets. So similarly in marketing, it is very important that you know the category in which you operate to the extent that you set your playing field. Next. Now, in order to know your category, one has to be very clear about the patient funnel. So the patient funnel is something that helps you to prioritize your source of growth. And once you prioritize your source of growth, that defines the category in which you operate from where you will get your growth. So if you take a classic patient funnel, say, for example, the diabetes population in India today, it is about 120 million is the number of detected cases of diabetes in our country. But then the nature of diabetes is silent. And then there are so many pre-diabetics, and there are another half of that population today who have, you know, impaired glucose metabolism, but yet they are not aware that they have diabetes. So to that extent, our diagnosis rate comes down to half from the actual prevalence of that particular disease. So your patient funnel actually starts with the prevalence of the disease. From the prevalence, you come to detection, which is much lesser. And finally, all that is detected, some of them may not get treated. When I talk of treatment, I talk of guideline-based treatment. So if a doctor gives a treatment which is not guideline-based, that qualifies as no treatment because that is not evidence-based. So we don't only have a diagnosis gap, but from the diagnosis gap, we also have a treatment gap. Now, the treatment of diabetes is done by different class of compounds. You have metformin, which is the standard of care, right? Then you have all this sulfonylurea class of drugs. You have the DPP-4 class of drugs. You have SGLT2 class of drugs. And you have the latest blockbuster, which is the GLP analogs that's making waves and really propelling the growth of the global pharma industry today. So when you talk of treatment, you have treatment by different classes of drugs. And then within each class, you have different brands. And finally, when it is treated by a particular brand, in the chronic space, you need to have a duration of treatment that is optimized in order to achieve therapeutic goals. Now, very often it happens, and I think people who are in chronic care will know this very well, that there are patients who drop off from the treatment for varied reasons. It's either because of cost or because the pill burden is too much, or they feel uncomfortable with too many medications they are not able to tolerate. So they don't take the drug for the defined duration. Now, what do you see here from this patient funnel? You can get your leverage points. So your leverage points, and here I'm coming to knowing your category. Your leverage point can be class share. Take, for example, if you're in the SGLT2 market and you are in the top 8 brands. So therefore, your growth, if you have set a growth objective of 25% for the next financial year, your growth will not only come from the class of SGLT2 drugs, but you will also look at shifting patients who are on DPP-4 or other classes of drugs like sulfonylurea to your SGLT2. So you will identify that subgroup of patients who are ideally recommended as per the guidelines and as per the clinical evidence, who would be prime candidates to benefit from your class of drugs, SGLT2, from where you will bring about a class shift. So if I have to grow by 25%, I have to define my category. And my category definition actually comes from this patient funnel, knowing exactly where I'm going to play, whether I'm going to play the class share game or whether I'm going to play the brand share game. I may also choose to optimize the duration of treatment by offering patient support and counseling services so that I prevent patients from dropping off from the treatment so that I'm able to extend the treatment. If currently my average duration of treatment is 3 months, then I will offer counseling services to make sure that I increase from 3 months to 4 months. So that 3 months to 4 months itself can give me a growth of 1/3 additional just by playing on the lever of duration of treatment. I might also choose to play the diagnosis game by doing HbA1c detection camps. And this is often the prerogative of market leaders because I need to expand the market. There are half the population who don't know that they are diabetics. And if I, as a market leader, take the initiative to embark on detection camps, I'm working towards expanding the pool of patients and therefore expanding that particular category. And that is where I play the leadership game as a market leader. So your patient funnel actually helps you to prioritize your leverage point. I might choose to play the diagnosis game if I'm a market leader or if I'm the top 3 brands. I might choose to play a class share game. I might choose to play the brand share game, and I might choose to play the duration of treatment. So all these 4, they are known as your leverage points or they are known as your source of growth. And if you play the class share game or you play the brand share game, that defines the category in which you will operate in order to propel your growth. So whatever game you play and whatever you do, whether it is in terms of CMEs, education, concept building, to move down the patient funnel, whatever initiatives you embark on, you must have a customer value proposition attached to it. If there is no customer value proposition, it's not really going to help you in your quest of acquiring patients or acquiring prescribers. Can we move on to the next slide? Now take, for example, you have 4 different leverage points from the patient funnel. Now, ideally, a marketer does not have resources to spend on all the leverage points. So therefore, one has to use certain criteria in order to prioritize or filter out your leverage points. So there are 4 criteria. Whether to choose class share, brand share, detection, or DOT, there are 4 criteria. The first is the size of the opportunity in terms of the number of patients, the growth that is seen in the market. What is the competitive intensity? What is the number of competitors that are operating in that particular category or for that particular leverage point? If there are 70, 80 competitors, it becomes highly competitive intense. If there are 15 to 20, it is low intensity. And if there are 20 to 25, it's of moderate intensity. Because the nature of our markets is such that, for any category, you have at least 70 to 100 brands when I'm talking of specialty care. What is your ability to win? So ability to win is basically the superiority of your molecule, the clinical evidence that you have. What does the data show in terms of clinical superiority of your molecule over your competitive set? Or it can also be in the therapy leading initiative, which is very unique and distinctive that only you offer to the customer, which is not being offered by any other competitive brand. So there also your ability to win becomes very high. Or you may have a well-trained field force who's very equipped, very skilled, very knowledgeable. So there also your ability to win becomes very high. And then what is the cost of doing that? Do I have the budget? Do I have the resources? If I do not have the budget to do it, then clearly, it is something which is good to do, but I don't have the resources to spend so much of money because it's going to consume a huge amount of budget. So I better channelize my resources in other areas where at least I can, get some traction in terms of increased patients or increased number of prescribers. So I use these 4 criterias, and then based on these 4 criterias, I will pick up at least 2, if not 3 leverage points to play on to define the growth of my brand. So that completes the second critical aspect of your brand plan, which is knowing the category in which you are going to operate by making use of the patient funnel, and through the patient funnel, prioritizing your leverage point, whether it's going to be a class share game or whether it's going to be a brand share game. Next slide. Very, 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 very important. In fact, this is at the very center of your marketing plans. So it is critical that as a marketer, you spend time in the field so that you are able to understand the challenges of the customer, what issues and problems they face when they manage patients in your particular category, and what is their approach, what is their belief towards certain category of drugs, molecules, what are the attitudes that they carry towards your molecule, towards competitor molecule. Is the attitude favorable towards you or is it adverse towards you? And what is their behavior in terms of their prescription or in terms of the choices that they make in diagnosis and in treating that kind of patients. So knowing your customer is absolutely very important. And in the next slide, I will show you some directives that will really help you to know your customer better based on the patient journey. Can I have the next slide? So basically, what does a brand manager or an area manager do in order to get insights? Well, we work in the field, we meet doctors, we meet customers. These interactions may be for 5 minutes or maybe for 40 minutes. But if you really want to get insights from the customer, my suggestion to brand managers is try to spend at least 3 hours in the doctor's chamber. In those 3 hours, you will uncover a trove of wealth which otherwise you would not have been able to understand. This is known as ethnographic research, ethnography. Ethnography means actually being with the customer at the point of usage of your brands with the customer. So we all have good relations with certain category of customers, whom we can call up anytime and, check on certain aspects for our brands or any information that we want. Why not we make use of these kind of doctors to sit in their clinics for 3 hours and try to understand the dynamics that goes on? Take, for example, you are in the cardiac space marketing anti-anginal drugs. A patient, when he comes to the doctor for the first time, what kind of conversation goes on? So the patient will try and describe what they feel, what exactly do they go through, what are the symptoms, that they experience. So they might say that, doctor, of late, I've seen that while traveling to work, even when I travel to the station to catch the train, sometimes I feel profuse sweating. So I think it is very hot, but it's not to do with the heat. But I just feel very uncomfortable and I start sweating. And then I suddenly get a chest pain. When I climb steps, I get chest pain. I feel a bit breathlessness while climbing steps. So a patient will try to describe what are the experiences that they go through, what are the complaints that they have, what are the symptoms that they have. So when you're actually witnessing it, it gives you a very clear picture in your mind as to what is the exact profile of that particular patient. So you know that this particular patient is an executive, maybe mid 40s, correct? He travels by train, leads a stressful life, right? Comes home very late. Because of that, he is not able to have his proper diet. His diet is compromised. There's a lot of stress. So there's a lot of history taking through this conversation that goes. And from the history taking, the clinician is able to come to some kind of a suspicion that this could possibly be the problem with this particular patient. So before you make a diagnosis, the doctor actually comes to a point of clinical suspicion. And this clinical suspicion happens through very smart history taking. I can tell you from my very own experience, the best of the doctors, they do 80% of the diagnosis through history taking, by just talking to the patient, understanding their lifestyle, understanding their pain points, their complaints, their problems, they're able to understand that. So in order to validate their suspicion, they will then embark on certain diagnostic tests. So in this case, he will say you do a particular ECG. So he will try to see the ECG pattern, and he will try to do a differential diagnosis between a stable angina or an acute coronary syndrome. So when he's able to do a differential diagnosis, then he will follow a treatment pattern or a treatment algorithm, and he will embark on a line of treatment. So when you're actually sitting there in front of the doctor and you're watching live the interaction, you're able to understand the patient profile much more better. You're able to understand the dynamics that actually goes on. You're able to understand what are the factors the doctor considers when making choices or making decisions. How does the doctor follows his treatment protocol? And when he follows the treatment protocol, you can check it with the guidelines, whether it is consistent with the guidelines or inconsistent with the guidelines. Where does your molecule fit in the overall treatment protocol? Does it come right on top or does it come at the back? If it comes on top, why does the doctor prefer using your molecule? What are the drivers which makes the doctor comfortable in using a particular molecule? If your molecule doesn't come on top and it comes number 3 or number 4, what are the barriers for it? What are the reasons why a doctor reserves the use of your molecules? So getting all these answers actually gives you insights on the basis of which you can build your plans. So knowing your customer in terms of their pain points, their challenges, what they go through, their symptoms, the algorithms for decision making, the treatment choices, the treatment algorithms, the drivers, the barriers, all these understanding really helps you to move further in terms of developing your brand plan. So the point number 3, which is a must to have, is know your customer. And when I say know your customer, my suggestion still stands to all of you. Try to spend at least 3 hours in a doctor's chamber to understand the dynamics that actually unfold in front of you, on the basis of which your product gets used at the very point of usage. Next slide, please. Yeah, next. So there are fundamental questions to answer in the construct of your positioning strategy. Now, the first is you need to understand your patient segments. How do you get your patient segments? So firstly is through the ethnography research, you have understood the complete patient profile. Secondly, we do an prescription audit. So when we do a prescription audit, we see that a cardiologist or a CP gives us 100 prescriptions for my brand or 100 prescriptions for the molecule. Now you have a breakup of these 100 prescriptions by indication. So you filter out the top 60%, top 70%. Always you will find that there are 5 to 6 indications which make up for 70% of the total usage. So these core indications then become your critical patient segments, which you will work on and which you will prioritize to build your brand. The second is clearly understanding which customers to target. So take, for example, if your molecule gets 100 prescriptions overall, you do a breakdown by specialty. So a cardiologist, a CP, or a nephrologist, right, will give you at least 70% of the total number of prescriptions. Then there will be a trickle-down effect at the level of GPs. So you know that these are the 3 or 4 specialties where the prescription salience is the highest. So they become your most important targets whom you will prioritize based on your prescription data. And finally, you will try to position your product in the mind of your customer so that you stand out very distinctive in terms of your value proposition and in terms of what is it so unique about your product in terms of the advantages or the benefit that you offer over your competitive set for that particular patient segment. So you know very clearly as to where your molecule stands in the doctor's mind. It may be at the top or it may be at the middle or it may be at the bottom. If it's at the top, that's great news. You need to just reinforce it in your positioning by talking about the superiority of your molecule. If a doctor prescribes another molecule, when actually your molecule is also better indicated, but for some reason the doctor prefers another molecule. So in your positioning, you will try to bridge the positioning gap between that molecule and your molecule by talking about how your molecule scores over in terms of the clinical evidence and the different superiority of your molecule over the existing molecule. And that's how you will bridge the positioning gap in the mind of that particular customer. So your positioning also, understanding what the customer prescribes is very critical for you in terms of positioning your brand by matching the data and the clinical evidence based on the doctor's prescribing habits. Next slide. So in your positioning, right, the fourth important point for your brand plan is to define your value proposition. And positioning is a very, very important aspect of your value proposition. Now, when you talk of positioning, there are 4 pillars on which positioning stands. The first is know your customer. That is for the management of hypertension or for the management of type 2 diabetes. Are they preferring my molecule? Does my molecule come upfront or does my molecule come behind? And what are the reasons for it? So I understand the drivers, the barriers, the motivations for a doctor either to prescribe or not to prescribe my drug. So this is fundamental. This is the very first pillar of positioning, which gets into defining your value proposition. Second is you know your category. That comes from your patient funnel, as I explained. Either you will play the class share game or you will play the brand share game. The third is you have to establish a point of parity. So before you talk about how your molecule scores over the other, you have to establish the fact how effectively your molecule reduces blood pressure with favorable impact on cardiovascular outcomes. So you will establish a point of parity before you get into establishing a point of differentiation. Take an Apple, for example. Even when Apple positions its product, it directly doesn't talk about its superiority over the existing set. It first talks about why it is superior as an AirPod or why it is superior as a smartphone. So first you have to make yourself synonymous with that particular category. And after making yourself synonymous with that particular category, you have to point out what is your differential over the existing choices. So the 4 pillars on which your positioning will stand is know your customer, which we have discussed, know your category, again, which we have discussed, your point of parity. So I help reduce blood pressure, I control blood glucose with weight loss, and I have a point of differential. The reduction that I do is significantly superior as compared to existing choices. And I not only reduce blood pressure, but I improve cardiovascular outcomes. I'm renally safe, right? And I have a very favorable effect on weight loss. So that makes me superior as compared to the other category of drugs that I use to manage this particular patient category. So these are the 4 pillars on which my positioning will rest. And positioning actually gets into defining your value proposition. So the first part of your value proposition is a very clear positioning in the mind of your customer. Next slide. So how do you define your value proposition? So your value proposition is nothing but a sweet spot that intersects beautifully between what you are offering and the need of that particular customer. So when the need of the particular customer is satisfied, or when the expectation of that customer is exceeded with your offering, that is where you have found that sweet spot in terms of a value proposition. So whenever you're trying to come out with the product that at a certain value, or you're trying to come out with a value-added initiative to a particular doctor, you have to test it out with your doctor in terms of how do they perceive it in terms of a value proposition. So the value proposition is not what I think is value to the customer, but the value proposition is what the customer thinks is value proposition to me. And here, let me give you a very good example from one of my previous companies, how we identified the sweet spot as a very solid value proposition that helped us to achieve our winning aspiration. So we were working in the therapy space of chronic stable angina. We were in the angina therapy. We were number 2 in the therapy space. And one fine day, when we were working on our annual operating plan, we said that next year, we've got to be number 1. So the gap was about 1 crore between us and the number 1 company, which means roughly 8 to 10 lakhs per month. So we said 1 crore is not very tough. Let us take the objective of, becoming market leaders. So for that, we really needed to find a good hook on which we could build our entire campaign related to angina and deliver value to customers. So we went around doing a survey with customers, telling them that, we are a very serious player and we thank you for your support. Is there something that we can do better than what we are currently doing to help solve your problems in managing angina patients better? So that is what we asked, a very simple question to customers to begin with. Is there a particular problem that you have which you're not able to solve? And what is it that we can do to help you, understand and solve these problems better? So the customers came out, with something which is not very surprising. They told us that the key problem actually in angina today is that most of it is undetected. So a patient who actually has angina, when he goes to a primary care physician, it gets misdiagnosed. So it gets misdiagnosed as a muscular pain or a gas. They get the wrong treatment, and then, it really worsens. And by the time it really comes to us, it's in a very bad state. So as an organization, if you can do something, to reduce the detection gap or to improve diagnosis, that will really help us in a big way. Now we said, okay, this is something very simple. We all knew about it. And every company who's in the angina space and every doctor knows about it. But did anybody do anything about it? Sadly, nobody had done anything about it. It was just status quo. So we said, come on, let us act as a responsible company and let us do something that can help the primary care physician at least recognize the clinical suspicion for angina, and then let them at least, refer these patients to a physician or to a cardiologist for better management. So we did a lot of literature search, and we found that there were some angina detection questionnaires available in the international market. So these questionnaires were actually running into 20 pages, more than 300 questions. And we really said that this is not going to work in India because no doctor has got the time to fill up a questionnaire of 300 questions. So what we did is we formed a steering committee of 13 leading experts all over the country. They got together for an advisory board. They looked at the questionnaire. They looked at what are the challenges that we face in the Indian context. They clubbed together similar sounding questions. They removed out the questions that were irrelevant. They added some questions, and they created a tool, right, known as a diagnostic questionnaire. We called it OPTA, which is Optimal Treatment of Angina. And this body came to be known as the OPTA National Steering Committee. So we made the questionnaire much more simple, kept it to not more than 20 questions in 2 pages, which was now easy to administer. So we combined this through mobile technology into a mobile app. Plus, we gave physical questionnaires to doctors so that they could use it in their patients. What we found out in those days, this was 2018, doctors are very comfortable with the physical questionnaires. So they would take it, they would tick mark. It was very easy for them to do. We got more responses to the questionnaires than through mobile apps, but that gave us a lot of data. Now, in these questionnaire, a doctor had to just tick mark certain characteristics that were applicable to each patient. So the patient would say that, the doctor would ask the question, do you feel sweating, when you walk or when you run? How often do you sweat? Do you feel anxious? Do you experience palpitations? While lifting objects, do you experience pain in the chest? While climbing steps, do you feel pain? Up to what distance do you experience pain? So these are the typical questions, and each tick mark had a score. And when you add up all the scores, beyond a certain threshold, it indicates that the patient is actually a potential candidate for chronic stable angina and he needs further investigation. So this really helped us to bridge the gap of diagnosis and open the eyes of physicians, to really have a proper clinical suspicion and not to miss out on angina. So this was something that was lacking. We didn't have these tools earlier. It was not being run in clinical practice. Everybody knew this was a problem. Nobody did anything about it. For the first time, somebody did about it. So we did this on more than 10,000 patients all over the country. And we did a lot of CME programs to educate customers on this questionnaire. And we also created national guidelines for chronic stable angina using a steering committee, and we got them published in JAPI. So all these activities together finally helped us to reach our goal of moving from number 2 to number 1 at the end of 1 year. So what I'm trying to tell you, my dear friends, whatever you think is a value proposition, get it tested out with the customer and try to understand whether they perceive it as a value proposition in the first place. It's not something which I think is a value proposition, but it is something that the customer accepts beyond doubt that this is the value which nobody else is offering me. And therefore, I'm very satisfied with this kind of a initiative that you are going to give for me for the benefit of my patients. So point number 4 is define your value proposition. Can we have the next slide? The 5th thing is that a smart marketer is one who anticipates and addresses barriers to execution. So what are the barriers to execution? From my own experience, I can tell you the number 1 barrier to execution is a lack of understanding of the strategy down the line. So the business head, the national sales head, and the marketing head, they work together and they formulate the annual operating plan. But you ask the medical advisor, or you ask a training manager, or you ask a regional manager or an area manager or a rep down the line as to what the strategy is. And then, there is no coherence in the interpretation or the understanding of what their strategy is. So one of the biggest barriers to execution is basically a lack of understanding. Apart from lack of understanding, the other reasons why strategy execution fails is because of lack of ownership. So remember, the strategy is created by a team in head office. This team may be an ivory tower team, or this may be a team that is moving in the field and meeting customers, but they are doing their job, right? They are the ones who formulate the plans. Now, they are the ones who actually offload the plans to the field at the point of execution. And at this point of transition, which is a very critical point of transition, this is where strategy execution fails. Because very often it is seen that the field is not in sync with the plans. They feel that, the plans are not relevant. They are not aggressive enough. Competition is doing far more than what we are doing. And I don't accept this. I don't own it up, as a result of which the execution goes for a toss. So how do you solve this? I think you solve this by having a simple understanding of a one-page strategy. Can we move on to the next slide? So this is a typical understanding of a one-page strategy for a particular brand. At the apex, what you see is the grand vision of that particular brand. So your one-page strategy starts with your brand vision to be the most preferred brand prescribed in its category. This was an antiplatelet category for PCI or medical management among intervention cardiologists or clinical cardios. So I want to be the most preferred brand prescribed is my grand vision. The leverage point comes from my patient funnel. So here I'm playing on the leverage point of duration of treatment and brand share. Then I define what is going to be my growth levers. So at that time, we had this NLEM coming into play. The price of that brand came down from 120 rupees to 11 rupees. So price became a critical growth lever for enhanced access. It was an originator brand trusted for its quality, being an original research product, imported from Paris. And despite the fact that, we brought down the price, we continued to import it from Paris. We didn't do a local manufacturing. So these were our growth levers. Now, from the growth levers, what are the different kind of initiatives that you are doing, operational initiatives? So you have a cath initiative, you do sampling in the cath lab because the patients are loaded with antiplatelets in the cath lab. So I have a sampling program over there to have usage at the point of initiation. I did different kind of symposia involving group of doctors together. And of course, I changed and revamped my brand communication. So if you create this one-page strategy where you have your brand vision, you have your leverage point from your patient funnel, you define your growth levers and your operational initiatives, you laminate it and give it to a medical rep, everybody is coherent and consistent in their understanding of what the strategy is. And therefore, their motivation to execute the strategy becomes much more sharper. And that is where, you will avoid failure in terms of execution of strategy. The second point about ownership, I think when you're creating strategies, don't create them in isolation. Work together with your sales teams. So create a task force among your sales teams of area managers, zonal managers, medical reps. Bounce with them from time to time. What are the things that are working? What are the things that are not working? If you have a certain campaign in mind, work with these confidants in the field. Take these confidants along with you, make them see some of your doctors, try to test out these initiatives with the doctors in front of your confidants and do it with at least 20 to 30 different people all across the field and make them your support system when you're rolling out your plans to your colleagues in the cycle meetings. Then you will see that these people, when they're involved in the plan right at the outset, there is no dissonance in their mind because the plan has not been created in isolation, but the plan has been co-created along with the custodians of execution. So anticipate the barriers to execution. Can I go back to the previous slide? Because there's a very important quote by Abraham Lincoln. So when you're talking about execution, remember this quote, which is attributed to Lincoln. Give me 6 hours to chop down a tree, and I will spend the first 4 hours sharpening the axe. So involve the custodians of execution, make them understand the one-page strategy so that there is a very clear articulation and understanding of strategy down the line. And there is no dissonance in the thought of people as to what the strategy entails. Last point, point number 6. You need to set measures of performance in order to understand how your strategy is doing. Can we move on to the next slide? So you look at a balanced scorecard. So the balanced scorecard actually flows from your vision and your strategy. There are 4 main dimensions of your balanced scorecard. The first is your financials. So you look at what is going to be your winning aspiration. I want to move from number 15 to number 10, which means I need to grow at a CAGR of 18% in the next 2 years for my particular brand. I need to have a turnover of XYZ. So with that turnover, I get a gross margin. Today, my gross margin is 75%. I want to improve my gross margin to 80%. My EBITDA today is about 30%. I want to improve it to 35%. So you set your financials and you work very closely with your cross-functional team, particularly with your supply chain team, to understand how you can impact your financials better. So if I have to improve my gross margin from 75% to 80%, I have to work very closely with my finance controller, with my supply chain team to understand how I could reduce costs in order to improve my gross margins and how I can really optimize all my expense heads so that I can improve the EBITDA profile of my brands. So keep measuring your financials, your sales, your turnover every month at the end of each review. Understand the reasons for the gaps, do the course correction, and try to make sure that you bridge on your gaps. So the first KPI is actually your financials. Second is the customer related KPIs. Customer related KPIs are very, very important because if you have to grow the brand, a critical determinant of growth is your prescriber base. If your prescriber base is growing, you know that your brand will definitely grow. So if month on month my prescriber base is increasing, that means I'm moving in the right direction. And therefore, I know that my brand is going to have a positive impact in terms of sales, in terms of growth. So my prescriber base, my prescription base are very important parameters and determinants. My P by D is also very, very important. Another very important measure, my dear friends, is basically your coverage and your frequency. So make sure that your coverage is at least 97 to 98% and your frequency is as close to benchmark as possible. Because if you don't achieve your frequency, you don't achieve your coverage, you are diluting your share of voice and you are vacating space for competition. The third is basically your internal business processes. So in internal businesses processes, basically it is your how you measure your in-clinic efficiency. So you'll look at your in-clinic efficiency scores. If you look at your learning and growth, you will look at your knowledge scores of your MRs. Are the knowledge scores of your MRs consistently improving over a period of time or not? If the knowledge scores are improving and if their in-clinic efficiency scores are improving, then you can be sure that the skill level of your reps are improving. And because the skill level of your reps are improving, the customer acquisition rate also will improve over a period of time. So all these indicators, which is the customer KPIs, internal business process KPIs, and learning and growth KPIs, they are known as the lag indicators, the lead indicators. These are known as lead indicators because they are predictors of a future outcome. If my prescriber base increases, my sales is going to increase. If my prescriber base is tanking, my sales is going to get impacted. So these are known as lead indicators. And financials are known as lag indicators. So lag indicators is what you actually see at the end of a defined period. So the sales at the end of a month, your market share at the end of a month, your profit, your growth, these are all examples of lag indicators. And financials are basically lag indicators. And all the three are basically lead indicators. Next slide. So this is the summary of all the 6 must-haves for your marketing plan. First is set your BHAG SMART goals. Second is know the category in which you operate through your patient funnel. Third is know your customer, the insights. What are the drivers? What are the barriers? Fourth is define your value proposition. It's not what you think is value, but what the customer think is value. I gave you the angina example. Anticipate and address execution barriers in terms of ownership, in terms of understanding of strategy. And lastly is KPIs to measure and monitor. The last slide. Thank you very much, my dear friends. It's been a pleasure to connect to all of you. I would like to invite you to my YouTube channel, which is Slim Talks with Anil Fernandez. So there are a lot of videos on strategy, leadership, innovation, and marketing, which you could make use of, or you could also follow me on my LinkedIn handle. Thank you very much, and we are open to questions.
Thank you very much, sir. Thank you very much. It was a excellent description on the 6 pillars. We all thoroughly enjoyed, and I hope all the participants who have joined live on Zoom also have enjoyed. Now I hand over to ICS Verma sir to take the procedure and take questions. And we also welcome all the participants who are there live, like Aditya, Adarsh Jain, Arjun, Bhavna Singh, Deepak Bhatti sir, Thala Ansari, Pooja Verma, Himanshu, Jinal, Mernil Candy, Pinaki, Prajakta, Priya Bora, Wazir Sheikh, Virendra Kulkarni, Virat Vishal to put on their videos and share their learnings and ask questions. So it is an interactive session. Any learning you have liked most, what questions you want to ask. So forum is open now.
Sir, hello.
Yes, yes, please ask.
Hello, sir. Firstly, thank you so much for this session. Sir, I have a question. As you mentioned that we have to at least spend around 3 hours with the customers, and I was doing my internship in a gynecology segment. So, how can I spend 3 hours with a gynecologist wherein the patients are uncomfortable with a
Yeah,
male
yeah.
candidate?
Yeah. So I completely empathize with you and I understand your point. So the caveat is for a gynae or for a derma, right? Depending on the condition of the patient, it might not be possible for one to really, do this. But if you're looking at a gastro or if you're looking at a CP or a GP, right, or even a cardio or even an ortho, we've been able to do it. Yeah, if you have a lady product manager and you have a very good equation with the gynae, and the patient does not know who the person sitting next is, she thinks that it's just an accompanying person, then there is a possibility that you can have a lady product manager just for the comfort factor. But you're absolutely right, and I agree with you. It'll be difficult in this case, and it will not be possible for you to be there physically in such a case. Yeah. Sorry about that. Yeah, you're right.
Thank you so much, sir.
Even in derma, that same thing is applicable for derma as well.
Thank you very much, sir. Any other question? All of you, please share your questions, learnings, any other point you want to add. ICS Verma, sir.
Yeah, so I have actually noted down many important points in the Anil's presentation. So just I would like to once again, share my learning here from the session so that, that will be helpful for everybody. So while talking about the 6 pillars of, brand positioning or the brand building, so it started with the SMART objective and BHAG, which I think, for the first time I'm actually coming across this word BHAG. So BHAG basically is a big, hairy, audacious goal. Having a big goal, which is specific to your brand and can give a time bound, and it can also link to the SMART goals. So that's where the BHAG basically is a driving force to your brand. So being a product manager, everybody should have that BHAG. What is their BHAG for the brand, and what are the SMART goals that they are going to define. And also, aligning your brand plan with your BU plan, your BU budget or BU plan, and the organizational plan. So this is very, very important, because you may be having a big goals, but your organization may not have that much budget allocated to that brand. So you should always have those sync with all these 3 parameters. And the second point, sir talked about, know your category. So after knowing your BHAG, the next thing is know your category, which talked about from prevalence to DOT, how you transition from understanding the detection of a disease to actually the patient support. So what are the different levels of activities that you can do as a brand manager? And you can bring a lot of patient education, concept building, and detection of disease. So these are many steps which you can include. So based on your brand category, if it is a chronic brand, you will always have a lot of privileges because not every brand has, but a chronic brand will always have that privilege. Whether it's a diabetes or CKD or CHD, so you will always have this privilege. And one more thing, the third point was KYC, know your customer. So this is building very strong post-COVID, because we were always thinking that KYC was only up to the customer, which is doctor, but even sometimes you have to understand the consumer, that is patient also. So in decision-making process, because you have to involve him from diagnosis to all the 5 steps. Again, there are 5 steps like diagnosis, treatment choice, brand choice, and duration of treatment. So in all these steps, you can actually understand. That's what we call it as ethnography. So sitting in the chamber, yeah, may not be possible for gynec and maybe dermatology, but it can be possible for many more than 20 other segments. So definitely you can sit with the doctor. And we used to even when I was in sales, we used to take our product manager and we used to sit with the doctor for 1 hour, 2 hours. At that those days, Mr. Hamid used to tell us, you go and sit in the doctor's chamber, entire day you sit. You choose the one of your most close doctor. You sit with him, understand how he's taking, what are the difficulties he's facing when he's treating his patients. So that is a very that
Great, great.
he
This is
was
great.
talking somewhere around 15 years back. So the kind
Fantastic.
of because we were privileged to report directly to Mr. Hamid, so he used to bring lot of these concepts very early in the industry. So once you are sitting with your doctor and understanding his problems while treating his patients, definitely you can come up with a strategy which will be suitable for that. Otherwise, most of the strategies end up in only at the before entering into the chamber. So I have seen lot of strategies designed by the product managers are not viable or not executable, because they never understood what exactly is my customer challenges are. So I think this point really very helpful for any product manager, whether he's a senior or junior, whomever is watching this. Definitely that will be a very game changer if they are going to follow this strategy. And then you talked about positioning strategy. So the continuation of positioning strategy, where segmentation, target, and where to position, which to, whether I have to target my, if I am dealing with for example, a nephro product, my target should be first a nephrologist rather than a physician. Because if a nephro prescribes, my top doctor prescribes, definitely my GPs and physicians will prescribe. So where to target is very important. Even though you may have 190 in your MCL, but who has to be given priority in the first go? So that has to be clearly communicated to the field people. Otherwise, they will always go to the easiest call rather than going to the tough call. So that is very important. And while defining your value proposition as a position now, as a part of positioning, so there are 4 pillars, which is KYC, know your customer, know your category, POP, that is point of point of
Parity.
paints, and then point of differentiation. So these are the 4 pillars in your positioning. And you also spoke about the sweet spot, which is the combination of all these competitor offerings, customers, and customer needs, as well as company capability. So where do you find that sweet spot? And you explained about a strategy that you have done, or you called the doctors across the panel, and they have decided on the angina, the diagnosis of angina, which is very important. Even still, we have seen a lot of deaths because of not awareness, the poor awareness of the patients. Nobody understands the real pain, whether it's a heart attack or a gastric attack. So I think, there should be even more work should be done from the marketing side, especially the companies who are dealing with cardiology. They should actually do a lot of programs they can reach to the corporate offices, in fact, because that's where you have a lot of stress. Maybe the companies the software companies, even pharma companies, they can reach to them, and then they can explain how how the symptoms of angina actually looks like. Because most of the times, we feel we can't differentiate the angina, and we have seen some doctors also died because they could not able to find out what is real angina, whether it's a gastric pain or angina. So there, there is a huge opportunity. What I could see is for the pharma companies to work on the patient education and patient awareness. Especially, you might have observed, sir, like, all the people who are in this team, they can agree with me that, post COVID, even we are seeing the heart attacks of 30 years, 25 years, people with very, very less age. So, and we are losing people just because they don't know whether it is, it's really heart attack. So I think, there is a lot of scope here for anybody who wanted to really work on this and can build their brand. So it is not only just you're helping the community, but you can build brand through this opportunity. And finally, you talk about the barriers to strategy. And the biggest barrier I know is the field. If you don't, align your field people with your strategy, that will never, you will never succeed. So before you are winning your hearts of the customer, first win the hearts of your team, field force, and they are going to make wonders. And finally, you talk about the review mechanism, which will be with a very, very regular intervals, and that will make your brand, more sustainable, and you can actually build the better brands. So this is my learning, sir. So thank you very much. Anybody can actually comment, or just they can share their experience.
No, brilliant ICS. Very well
Thank you,
summarized.
Verma sir. Brilliantly summarized all the learning points. That is great for the viewers' point of view. So as I mentioned, it is now session is open for next few minutes. If someone want to ask any question or share their learnings, yes, you can put on your video and audio and share learnings. Anyone? Yes. Any thought? Any learning? Okay, so thank you very much, everyone. I hope it is an excellent session for the not only the beginners but also seasoned brand managers. Whenever they are going to have their brand plan for the next quarter and next financial year, it will be a great help for them. I once again thank ICS Verma sir and Anil Fernandez sir for an excellent session on brand plan, and it will be used for everyone great. So we look forward to you all for the future sessions also. And once again, thank you very much all the viewers for your active participation, sharing your learnings, all the Facebook, YouTube viewers also. And we also thank Imagika Health for their continuous support. Thank you. Thank you very much.
Thank you, Imejika. Thank you, Anil sir. Thank you very much. Thank you, Ashwin.
Thank you. Thank you, everybody.
Thank you.
Yeah,
Thank
thank
you.
you. Good day.
Thank you.
Thank you. Bye.
Bye. Bye. Have a great Sunday.
Yeah, you too.
I think we can inform Imejika to.